Hi there, Dr. Terry Schoenfeld for UAB Department of Medicine. In this video, I'd like to discuss the preoperative evaluation of patients with diabetes. So surgery results in a functional insulin resistance. There's a complex interplay between surgery, general anesthesia, and the whole perioperative setting with changes in nutritional status, potentially infection, things like that lead to a neuroendocrine stress response with release of counterregulatory hormones, things like epinephrine, glucagon, cortisol. And all this results in metabolic abnormalities, including insulin resistance. There's decreased peripheral glucose utilization. There's impaired insulin secretion, impaired lipolysis, and protein catabolism. And all this leads to perioperative hyperglycemia, even in patients without diabetes. And it's important to note that diabetes is associated with increased risk of a variety of postoperative complications and increased length of stay. This is figure 1 from a study, an observational study done at Emory University that looked at about 3,000 surgeries. And what you can see here in all of these cases, in the dark bars, are patients with diabetes. That diabetes increased the risk of a variety of outcomes. Now, this increased risk of death, even though it was increased by an absolute of 1%, it did not reach statistical significance. The p-value was 0.1. But I think the trend is certainly there of an increased mortality in patients with diabetes. And all these others, other than acute MI, also reached statistical significance. So diabetes is an important risk factor in postoperative complications. And there are two aspects to the preoperative evaluation of the diabetic patient. One is to determine cardiopulmonary risk, and really cardiac risk is greater in these patients than pulmonary risk, and to assess their diabetes. So cardiac risk, you have to think back to the cardiac module, but diabetes is a risk factor for cardiac events in the perioperative period. And it's one of the components of the revised cardiac risk index, or Lee criteria. So when you evaluate a diabetic patient's cardiac risk, you want to use tools like the Lee criteria, the Gupta tool, to try to figure out their cardiac risk from the planned surgery. Diabetes assessment is multifactorial. So one of the things we need to know is the patient a type 1 or a type 2 diabetic? And this is important because type 1 diabetics are dependent on insulin to prevent ketoacidosis. So they always need some level of baseline insulin in their system. So it's important to realize if the patient's type 1 or type 2 diabetic. We need to know what medications are taken to control their diabetes for two reasons. One, we need to dose these in the perioperative period. And number two, we may need to adjust them in the preoperative period to try to maximize glucose control. We need to know their frequency of blood glucose monitoring just so we get a sense of how well managed the patient is prior to surgery. We need to know their baseline metabolic control. We need to know, or we even need to check an A1C if it hasn't done in the previous 4 to 6 weeks prior to surgery. And this is important because there's suggestions that elevated A1C levels can predict higher rates of postoperative adverse events, including infection, MIs, and mortality. So if patients have high hemoglobin A1Cs, number one, we'll have to remember that it will increase their risk for surgery. But also, number two, we may want to delay surgery if we can and try to improve their glycemic control. We need to know if they have hypoglycemia and how often they have it and how severe it is. And very importantly, are they aware that they're having hypoglycemia? Because as you know, patients during operation and post-operatively are going to have altered sensorium and may not be able to tell us that they're hypoglycemic. And so if patients have hypoglycemia unawareness, we're going to have to probably check their sugars a little bit more frequently intraoperatively and postoperatively than we might do if it's somebody who can actually sense that they're getting hypoglycemic. So what about the characteristics of surgery and anesthesia? These are two other things we need to think about as we evaluate a diabetic patient in the preoperative period. So surgery, it's important to think about several things. Number one, is it a minor or a major procedure? Major procedures are associated with a lot greater metabolic disturbances. We also need to think about what time of day the surgery is planned for, because this is going to affect how long a patient is without food, and also it's going to affect how we dose their anti-diabetic medications. And finally, we need to think about the duration of surgery. Longer surgeries are going to be associated with greater metabolic abnormalities. And finally, we need to know what type of anesthesia is being planned for the particular procedure, because epidural and regional anesthesia really have very minimal effects on glucose metabolism, and we don't have to worry about it as much as if a patient is undergoing general anesthesia. So in the next video, I'm going to discuss how we adjust medications for diabetic patients in the perioperative period.